Tuberculosis, or TB for short, is usually caused by a bacteria called Mycobacterium tuberculosis. It is a large non-motile rod-shaped bacterium. It is 2 to 4 micrometers in length and between 0.2 and zero point 0.4 micrometers in width. It is an obligated aerobe, and thus it is mostly found in the upper part of the lungs or other oxygen-rich areas. It divides extremely slowly for a bacterium, taking between 15 and 20 hours to divide. It is very resistant to drying due to a high percentage of lipids found in its coat. There are two known resistant strains: multidrug resistant TB, or MDR-TB for short, which is resistant to isoniazids and rifampin, which are used in the treatment of TB. There is a rarer strain of TB called extremely drug-resistant TB, or XDR-TB for short. This is resistant to both of the previous drugs and also the secondary drug used in treatment of TB called fluoroquinolone. When an infected person coughs, sneezes, speaks, or spits, tiny droplets become airborne. These can carry the bacterium, which enters the person's lungs and can proliferate into an infection. The majority of the bacilli are digested by alveolar macrophages. However, a small number may survive and spread to other organs such as the brain, kidney, or bones via the bloodstream or the lymphatic system. Colonies form in what are known as Goen foci. As said before, the bacteria are mainly consumed by macrophages. This can be effective and kill all the bacteria, or the bacteria can also become dormant and never cause disease at all. This is referred to as latent infection. These bacteria can then reactivate at later times when the immune system is low and cause secondary TB. The adaptive immune system deals with TB like it would any other pathogen. Latent TB will not display any outward symptoms. However, a tuberculin spot test will confirm the presence of TB. This involves injecting tuberculin fluid into the skin. This uses a purified protein derivative from TB. If the person has had TB before, antibodies will recognize the PPD as a pathogen and the immune response will cause a lump to form. People with active TB are easier to identify by constant coughing, possibly blood, fatigue, fever, discomfort, and unintentional weight loss. A spot test is also used. Once TB has been identified, treatment can begin. Drug treatments last a long period of time, typically 20 to 30 months, to ensure TB does not come back. Latent TB treatments last only about 9 months. Isoniazid, rifampin, ethambutol, and pyrazinamide are used in treating latent and non-resistant strains of active TB. The fluoroquinolines amikacin, kanamycin, or capreomycin are used in treatment against drug-resistant strains. Fluoroquinolines, amikacin, kanamycin, or capreomycin are used in treatment against drug-resistant strains of TB. Before the advent of antibiotics, TB was a major killer in Ireland. Around the 1900s, 227 out of every 100,000 people died annually of TB. 50% of the people infected died. Due to the large family sizes of pre-modern Ireland and the damp air in cold cottages, TB was particularly easily spread between family members. As a result of this, sanatoria were set up. A lot of the patients who were admitted often did not leave due to the high mortality rates. Another problematic factor in Ireland came from the farming of cattle. Cattle can develop bovine TB from Mycobacterium bovis. This can then spread to humans. One countermeasure is the injection of M. bovis in the bacteria responsible for brucellosis. One way of curbing the spread of TB from cattle to humans was the introduction of TB testing. This involves injection of dead TB cells into the animal. If a raised lump is found, this indicates the animal may be infected. The animal is then tested to confirm TB. If it is found to have TB, it is then taken to slaughter and the farmer is recompensated for the loss. Badgers and deer can often spread TB to cattle. As a result, badgers are also culled.